Good afternoon, everybody. Today is a very important session, though very basic session. Every time we've been talking of lot of special and esoteric things, but a very basic thing. What is the commonest thing that is done to a patient who's hospitalized? What is the commonest thing, procedure done on a patient who's hospitalized? Yeah. So if you want to go one step before that, what else would be done? So blood sampling, right? So we've already done a session on how to collect blood sample for various investigations. But those are the two painful things that we are forced to do, right? And if those things don't go right, our patients are very upset. You may give the best of care, but if you couldn't get the IV in the first shot or you had to make multiple attempts, then a lot of unpleasantness. So அதனால ஐவி லைன் போடுறது வந்து இன்னைக்கு எல்லாரும் நர்சஸ் தான் இருக்கீங்க, பட் நியாயப்படி எனிபடி நர்ஸ், டாக்டர், physician assistant, technicians, everyone should know how to do a IV access, right? So that's a basic skill that we should all have. And so this is a very important session. At the end of it, you have a mannequin in which you can practice. We'll first listen to the session and then I will share whatever tips and tricks I have for you to increase your first time success. So we are very happy to have Dr. Sridhar. Can you just stand? He is a pediatrician with special interest in neonatology. And as you know, pediatric IV lines are difficult, means newborn IV lines are the worst. So we will also get some tips for you from him. Any of the newborn nurses are here? Yeah, okay, right. They're born long ago. Sister Selvi, sister, over to you.
Thank you, ma'am. Good afternoon, one and all present here. Behalf of our nursing education department, I am very glad to welcome you all, for each one of you, for this session. My special thanks go to Dr. Patta Radhakrishna sir and Dr. Vidya ma'am and our Lieutenant Colonel Nirmala Iyer ma'am, Chief of Nursing, and our special guest, Sir Pediatrician sir. This is one of the important nursing procedures for day-to-day life. Our nurses, they are doing these procedures. We are going to do some role play. Before that, today we are having our new induction staff. So I'm going to present about mastering of difficult IV cannulation with role play technique. IV cannulation is important procedure for nursing practices. Safe and effective cannulation not only reflect that effective treatment, and also it's build the patient confidence and trust for our care. Introduction of IV cannulations. Who all are thinks that IV cannulation is a simple procedure? Raise your hand. Why we are not thinking that it's not simple procedure? Because that vein will reflect that this is simple or challenging procedures. Okay. Introduction of IV cannulation. Intravenous cannulation is a fundamental clinical skill used across healthcare setting to provide direct access to the patient bloodstream. Safe and effective IV cannulation require knowledge of anatomy and aseptic techniques and equipment selection. Vein selection also is crucial for effective IV cannulation. And assessment. Assessment, you have to assess that whether that patient is paediatric or else sometimes they are in elderly patients, and complication preventive measures also is very important for IV safe practices. Mastery of these skills help ensure prompt treatment, enhance patient comfort, reduce procedural risk, and support overall continuity of care in clinical environment. Indication of IV cannulation. Today our new joiners, they are going to say what is the indication for IV cannulation. Can anyone say that what is the indication we are doing IV cannulation? Jasmine?
Administration of IV fluid, collecting blood samples, IV fluid therapy, nutritional supplements.
It's good, correct. Other than this, you want to say any important measures we are doing that IV cannulations, audience? For blood and blood products and blood sampling, for the blood sampling purpose also, we are doing that IV cannulation. Administration of IV medication. Suppose that patient, they can't able to take orally, so we are giving for IV medication like antibiotic, any allergic, any analgesic drugs, example. Then coming to IV fluid therapy. For trauma or emergency surgery, patient need rapid onset of IV fluid action. We are using this IV fluid therapy. Emergency situations, we all know that emergency in ER, trauma, or patient had any life-threatening situations, that IV cannulation is crucial for that patient. Blood sample collection is one of the important measures. That patient is having fragile thin vein. That patient need multiple sample of blood collection. We are using that blood sample collection for one of the technique. We are using that IV cannulation. And blood products. What are the products we are transferring for our patients? FOB, platelet, and PRBCs. Okay, if you are going to transfuse blood and blood products, good IV cannulation is very, very important. Then nutritional support. Once patient who cannot able to take orally, that patient need parenteral nutrition to maintain their nutritional status. For that patients, we are using this IV cannulation. Diagnostic process. Can you say what is the diagnosis process we are using this IV cannulation? CT, yes, good. CT contrast, we are using IV cannulation for the diagnostic process. Therapeutic procedures during surgery, patient in operation theaters, they are using that IV cannulation. Maintenance of vascular access. Then next we are move on to advantages of IV cannulations.
Patient unable to take oral medication, deliver large volumes, and control the drug delivery, supports diagnostic procedures.
Okay, fantastic answer. Rapid onset of action. Suppose that patient need rapid action. Immediately we have to give some effective measures to intervention to prevent their pain. Example, when patient came with hospital with severe pain, oral medication is taken place to take action. So immediate action needed means we can, that reason we are doing that IV cannulation. And accurate and controlled drug of delivery. Example, ionodrop drugs or any life-saving drugs, we have to give precise medication, we can do that IV cannulation. Ability to administer large volume of IV fluids. Suddenly patient went to life-threatening situation or hypovolemic shock. We want to give excessive fluid to save that patient. Patient need effective IV cannulation. Then suitable for patient unable to take oral. This already we have discussed. Multiple uses through a single access point also is important, and reliable vascular access in critical situation. We all know that for code blue situations, the team immediately they will come and ask where is that IV cannula. Okay, so any life-threatening situation medication we want to give, that IV cannula is very, very important. And support and diagnostic procedures, then flexible duration of doses. This is the advantages for IV cannulations. For this procedure, we need some of the basic equipment before going to perform that procedures. Okay, what are the basic equipments needed for IV cannulation?
A tray containing different sizes of implants, gloves, tourniquet, alcohol swab, hand wrap, and plasters and tegatram.
Yes, good, correct. That equipments we are divided into three types. Cannulation equipments. Cannulation equipments means we have to select the cannula according to the patient's vein. Sometimes it's thin flagell vein. We can't use that 18 gauges of cannula. Then IV extension and IV tube also is needed. Then coming to infection control practices, we have to use that sterile gloves to prevent infection. And aseptic solution like hand rub solution or alcohol swab we can use to prevent infection, and sterile gas and sterile transparent dressing. Why we are using that sterile transparent dressing? Anyone? To prevent phlebitis. We can easily see that insertion site. To visualize the insertion site, transparent dressing is one of the measure we can assess that whether they are having that phlebitis. Then supporting equipments like tourniquet is very important to assess the vein, and sharp containers. After IV cannulation, is there chance to get prick? Okay, we can get prick. So soft container is very important. And protector sheet during that cannulation, patient that spillage can taken place. To avoid that, we have to use that protector sheet. Then coming to site of IV cannulation is very important. So this is our nursing basic procedures. So who all are the nurse going to perform that IV cannulation? They have to know that which is the site for IV cannulations. Okay, common site for IV cannulation for our staff. Metacarpal is a common site for IV cannulation. Common site for blood sample collection. Brachial. Antecubital is a common site for blood sample collection. Commonly we are using that cephalic vein and basilic vein, and median cubital and metacarpal. Okay. How we will be identify this cephalic vein? Where is that cephalic vein? Thumb. Okay. It's near the thumb, and around the thumb is a cephalic vein. Basilic vein? Inside of this area is a basilic vein. And metacarpal, you all know, this is the common IV site for IV cannulations. Then coming to common complications. Okay, so common complication, what all are the complications patient had for IV cannulations? As a nurse, we have to know that what are the complications, then only we can take prevention measures. Infiltrations. Infiltration is one of the, Vishal, what are the common complications for IV cannulation?
Phlebitis, infiltration, extravasation, and hematoma or local infection.
It's good, correct answer. Infiltration. Infiltration means what? During our induction and daily bedside also I used to teach that what is that infiltration. Okay, that first picture shows that this is the infiltrations. Sir? Bulge is correct. That fluid is leakage in the surrounding tissues. Okay. Then coming to extravasation goes to Dr. Suman sir, because vesicant drug easily will cause extravasation. Sir, can you explain that? Last week also we have attended one sessions for IV cannulations, preventive measures. It's arranged by our Dr. Suman Kalyan sir.
Last week we had one full session, 1 hour session of extravasation. It's important in many irritant drugs. So we have two types of drugs, irritants and vesicants. So we give cold sponge, and the other one we give warm.
Yes, sir.
Last some student. Okay,
Okay.
Thank you.
Okay, thank you, sir. Phlebitis is one of the common complications. So here we are following early identification of phlebitis. So our nurses each shift, they are assessing patient IV site, and additionally they are giving education to that patients, whether if you are found that any redness, swelling, immediately call me. That education we are giving. So each shift our nurses, they are assessing that patient IV site. It shows that sign, we are following that VIP score. VIP score means visual infusion phlebitis. So that score shows that 1 means immediately our nurses will remove that IV cannula. Suppose that patient is not willing to remove IV cannula with the help of DMOs, or sometimes we will get help from our senior consultant. Then thrombophlebitis, we all know that thrombophlebitis is also one of the common complication for IV cannulation. So commonly lower extremity cannula, if we are using that lower extremity, that time patient can have that thrombophlebitis. So here we are not using lower extremities. And hematoma, infection, air embolism is very rare complication, but it's life-threatening situation. Accidental cannula dislodgement also one of the complication of IV cannula. Then predictor for difficult cannulations. Nowadays we are facing some challenge to do IV cannulations. So for induction staff and in-service education, afternoon shift nurses, they are having that practices with manicure, hand manicure, how to do that IV cannulation before going to perform in the patient bedside. So there are 3 factors. It's one of the difficult for IV cannulation. Coming to patient. Can you give what is the example? Age also one of the factors. Dehydration. Dehydration means we can't able to visualize the vein, and obesity, chronic illness, paediatric and elderly is one of the reason. Vein, then sizes of vein, depth, visibility, fragility and mobility vein. This is also one of the reason we had difficult IV cannulation. Procedure factors coming to experience and equipments. Then evidence-based cannula technique, vein selection is very, very important. Then site selection also very, very important. And cannula selection also very, very important. So I have displayed in the whiteboard what are the sizes of cannula and what are the uses for cannula. Yes, sir.
Vidya, this is for you. I was a house surgeon in Jipma, Pondicherry, and then we were posted in the ICU. There's one lady who was doing MD, Ramesh's wife. One fair, you remember? Very brilliant. She's in the UK now. She was the chief of the ICU that time. One 18-year-old girl was brought in unconscious who had headache. She's wearing the school uniform, half sari, green, white. And she was seen earlier in the OPD, and Dr. Vidyasagar has seen local gigantism. 2 fingers are, the note, you see the Jipma has got a very good case sheet maintenance. And then, I was asked to start an IV line. I was trying, but not, the skin is sort of stretching this way, that way. Then I didn't know what to do. Then I called her. She just looked and she says, Ehlers-Danlos. Ehlers-Danlos with a berry aneurysm rupture. The girl didn't survive. I mean, that I remember very well. There are situations where it's difficult to... Have you come across any situation like that where the skin just keeps on stretching? And her 2 toes are so very big. That's one of the... That's how I remember. Then I knew that Ehlers-Danlos are 5 types. And a certain type 4 will have berry aneurysm rupture and so on. Yeah.
Thank you, sir.
Just to take the
Sure,
wariness
sir.
away.
Thank you so much for your information, sir. Then coming to technology and adjuvants, vein visualization devices. In our hospital, neonatal ICU, we are having this vein visualized devices. So this is one of the measures for newborn babies. We can use this vein detector to identify the vein. Ultrasound guidance also one of the things, it's easy to assess that vein detection, and smart catheter and safety devices also nowadays they are using. Then coming to nurses' responsibility is very, very important for IV cannulation, because this is one of the basic nursing skill procedures. So before going to perform procedure, Sagul, what are our responsibility before going to perform this procedure?
Pre-procedure, confirm the patient identification.
Yeah,
It is a very
good.
important to confirm the patient. Explain the procedure to the patient. Select the appropriate cannula size and site. Gather the equipments. Aseptic technique.
Good, thank you. So before going to do that procedure, our responsibility, nurses has to identify the patient with two universal identification. What is the two universal identifications? Name with a UHID. After that, you can do that procedure. Then explain the procedure to the patient. Why we are explaining? This is simple procedure, but we are explaining to the patient. Then only we will get cooperative from the patient, cooperations, and select the appropriate cannula is very, very important, as we discussed in early cannula and site selection, and equipment preparation is very, very important. We all know if you are if you are taking that IV cannula tray, if you are not carry any sizes of cannula or any equipment is missed, once you are coming from out of that patient room, it's difficult to go and do IV cannulation, because after you are coming from that patient room, sometimes call bell will be ringing, or sometimes consultants coming for the rounds, so you will be busy with that. So you can't go, it's challenging to go inside and perform this procedure. So before going to the patient bedside, you have to take all the needed equipments and perform hand hygiene is very, very important. During that procedure, ensure patient comfort, because this is one of the emotional procedure. Yes, I can say that because I had the experience of difficult IV cannulations. It's taken 2-3 times prick means we will get emotional feel. Okay. Then you have to give comfort position and support. You have to give one support like pillow also we can use under their arm and reduce their anxiety. How we can reduce their anxiety? You have to explain the steps of procedures. Okay, so then their fear will be reducing, and apply the tourniquet is very, very important to get the venous access, and clean the site, and you have to wait for a second to dry that alcohol and insert the cannula safely. As proper technique also is very important. What is the angle of degree we have to use for IV cannulation? 45 degree, 20, 15 to 30 degree. If you are using that less than 10 degree, what is the common injection we are giving in intradermal? Okay, intradermal is one of the ankle we are using that less than 10 degree. So 15 to 30 degree is suitable for IV cannulations. So after procedure, dispose safe sharp container. We have to dispose the needle in sharp container and label the cannula. It's very, very important. So you have to write the date and time of insertion. Then next, document the procedure is very, very important. After cannulation, we are having the nursing flow sheet. So in that flow sheet, our responsibility, we have to write the, we are having daily assessment sheet. In the sheet, so here one of the column we are using this. This column represents that sizes of cannula and site. Example, metacarpal or basilic, cephalic, and score, VIP score is shipped. Here 3 column is prepared morning, evening, night. Each shift our nurses, they are assessing that VIP score, and dressing is intact or clean and it's secured. Patency also they are checking and they have given their signature. This is the nursing documentations for IV cannulation. Then educate to the patient is very, very important. What are the common education we can give for that patient? Don't wet that hand. Yes, good. Next. If you want to get up from the bed, you can use the elbow support. Okay, then next. Any other education? If suppose they have found that here they are having any redness and pain, means immediately they have to be informed. And usually we have that thought, if suppose any surgery site, we used to do that like scratching or touching that area for we are doing something. So we have to give education, unnecessary, don't touch that area. Okay. Today I have covered that theory topic. Now we are going to perform the IV cannulations in the role play method. Now our new joiners going to learn about that. Yes, sir, please.
Thank you. Congratulations, Dr. Vidya, for arranging this, and Dr. Patta as well. Very nice to see so many nursing students as well as nurses here. I mean, I am a neonatologist, and as Dr. Vidya said, neonatology is nursing based. You have one NICU nurse as well, so the outcomes we produced in the NICU are all thanks to the good nursing care, and the same applies to any field of medicine. You are underappreciated, but definitely the work you do is going to be helping many patients achieve the best outcomes, whichever area you're working in. So congratulations to all of you for selecting this field and doing such a good job. Thank you. And so many of you being here is testament to the support you get from the nursing leadership, which again is amazing. Yeah. That's, I mean, I wish we could do this in our unit, because to spare so many people to come here takes dedication. I mean,
all these people are on shift at 2 o'clock. They are coming
early.
1 o'clock just to attend.
And she presented very well as well in engaging the team. Thank you. Just a few comments. I mean, one is obviously, before you speak of anything like this, infection control, because there is a study called the Dennis study which looked at the infection rate in the 3 hospitals in Delhi, newborn units. And even without any risk factors, we found that the patient got sepsis from hospital acquired bugs. So on the day 1. So from the time of delivery, or even from the care of the mother, multiple PV examinations is a risk of sepsis. For the baby, hand hygiene, asepsis from the start, and any IV cannulation is a source of infection. You are breaching the skin barrier, so she talked about gloves and asepsis, how to observe, but it should come from within our heart that the single action that we are doing is actually breaking one of the most important barriers we have. You are going right into the bloodstream. So you are very powerful at that time that you can introduce infection which can kill the patient. So be aware of that. Infection control is the most important step. I think you could have focused a little more on infection control. I know you do sessions, but each time we teach procedures like this, infection control should be in the background. Same applies to suction. I mean, many of you may not be aware that even simple suction can cause bacteremia and introduce infection. So because you are breaking the barrier, the mucosal barrier, and you are already colonized, the skin is colonized with bugs, the mucosal membrane is colonized with bugs, you are triggering it. You know that you get bacteremia when you brush your teeth, right? When we are waking up and brushing our teeth, we are sending bacteria into our blood. But we are healthy enough to fight them off. But the patient who is immunocompromised, the simple things you do, the bacteria holds on. So just a simple message from my side. And I have a YouTube channel, same as Dr. Vidya and Dr. Patta. I think you should follow their channel if you are not doing that. Marvelous Medicine. I'm sure you will share it, the nursing leadership. My channel is easy to find. It's Sridhar K. If you search on YouTube, you'll find it. And there is a playlist for nurses. And my aim is to teach both parenting and neonatology and basic pediatrics. So go through it, and obviously congratulations again. I'll need to go now.
Okay,
but
I have one question. Now, because when we were posted in pediatrics, the only thing we were taught is to start IV line in children, which is not easy. Mothers used to cry seeing their babies get punctured. Do you allow the mothers to be there when the lines are started, or you keep mothers away?
Yeah, it's okay. It's a very difficult question, especially I am working in Dubai, and obviously the mothers in UK and Dubai, I worked in UK before that, and they are very protective and they insist on being there. It's not like here, Amma nee poi velil nillu solla mudiyadhu. So, Jipmarla, I mean, all my colleagues, some of them are from North India, as you know, and they speak broken Tamil. Amma nee enna solra velila poi nillu. So, it's just a simple way of putting them out of the room. We cannot do that when you go here. Also, this is a corporate hospital, so customer service plays a big role. And obviously we have to encourage what they want. We give them the choice. Do you want to be there? We would prefer that you are not here because it makes a cannulator nervous as well and you would be anxious about it. So obviously if they insist, we can tell them that it's not an easy procedure and sometimes we need 2 to 3 pricks and one person will not try more than twice according to whatever you practice. So it's easier said than done, but there are patients who insist on being there when you intubate even. Even though we discourage, if they insist, we have to allow them. That's a problem. I know Dr. Vidya would be the OT and things.
Sometimes having the mom may actually help you cannulate. Depends what kind of parent, because they can hold the child without moving.
Yeah.
Some of the mothers can help.
Non-pharmacological pain relief. I mean, all of us are aware. I think you must be practicing the non-pharmacological measures to reduce pain. Mother holding and even breastfeeding when you are doing a procedure is the best way. Thank you for bringing that.
Do you have any criteria that you should attempt more than twice?
Yeah.
Sometimes you can't recall it.
Yeah. We do. Yeah, we don't try more than.
As an anesthetist, you do that?
Yeah, when my colleague anesthetist will come.
Really?
Yeah. Unless if you are stuck without nobody else around, then that is different.
Do you fail sometimes?
Under anesthesia, we may try more than once if there is nobody around. But awake patient, we don't try more than twice.
Right.
But you lose confidence yourself. Yeah, please.
Thank you so much for coming.
Thank you for coming. Thank you for sparing your time.
Here one thing also I have to inform that if we are facing any difficult for IV cannulation, sometimes most of situation will face the difficult cannulation. In the time our process is we are calling our nursing supervisors. Nursing supervisors, Sony sister, please come forward. So with their help, they are arranging ER and MDCU staff for helping our nurses. Even though we are facing some difficult for IV cannulation, we are having only one hope, anesthetist. So your support is yours.
Though Karkandhu is supposed to be multidisciplinary, we are not having enough doctors here. So I have told Nirmala madam to talk to Revati and Kalpana ma'am that this session what you are having has to be done for DMOs, has to be done for registrars. Everyone is first a medical professional or a doctor first, other things later. Technically even Radhakrishna should be retraining for IV. You understand? All of us have to train and retrain. Avladhan. Retrain. Meaning even if you can, you are supposed to recertify yourself by doing once in a while, and you don't have to do on a patient, you can do on a thing. So in our OT, I can say I am partly responsible because I am one of those who does everything that I am supposed to do myself. But we started this policy a couple of years ago that our anesthesia technicians will take the access for the as soon as patient comes into the OT waiting area, they will secure the IV line. And and if they are become so good that they will know, madam, in the line ningle potrunga. You know, we are wise that we don't try when we know it is difficult. We automatically call the best person for that without trying. Because in children, what happens if you already tried 3-4 times and then call? I mean, I am not a superhero, or my teams are not like, after all the obvious veins are gone, we cannot find a new one. So when to call, the 2 pricks is standard, but I suppose you are a junior nurse, you tried twice. Then you called your senior nurse, she tries twice. Then you call your team leader, she tries twice. Then you call the ICU nurse, she tries twice. And then you call anesthetist, they cannot help you. So you should know when to skip that turn. This vein I cannot do, I need help. Nothing wrong in that. This vein I need help from before, because sometimes patients appreciate that we are, doctor, ward la avlo vatti kuttinanga neenga avlo super pottinga. Why? Because we have a trolley. You are stuck with a bed and you have access only from one side of the bed, the other side. So invariably you try to do from the side of the bed which is open. The bed is low, so your height is a problem. You don't have enough light. So in the OT we have good position, good access, good light, good help. So when you think that IV is going to be difficult, even if it is a busy time in the ward, make sure another person holds. Tourniquet is good, but there is nothing like somebody else holding. Because one is the human touch. Because the other person is also talking, two of us are talking to the patient. So, and stopping movement. Tourniquet will not stop the patient from withdrawing hand. Whereas if somebody is holding, they are not only holding the hand for making the vein prominent, they can also prevent the patient from moving. So another trick that I learned, instead of saying, "Aatadinga," you say that try not to move. Because when you say don't move, people take little offense and then they say, what is it like, as if I'm moving deliberately, no? If you say, please try not to move, they really try hard. This is just some random thing I learned out of practice. Instead of saying, please don't move, you say, please try not to move. So then they really put all their effort in trying not to move. And then if it moves a little, you adjust. ஆட்டாம இருக்க இல்ல ஆட்டாம இருக்க அந்த ட்ரை வேர்டு யூஸ் பண்ணிடுவேன். ஆட்டாம இருக்க ட்ரை பண்ணுங்க. இல்ல அப்படி இல்ல. அவ்வளோதான், அப்படிதான் சொல். ஈவன் ஃபார் ஸ்பைனல் and all we found that very useful. முடிஞ்ச அளவுக்கு ஆட்டாம இருங்க அப்படின்னா ஃபுல்லாக ட்ரை பண்ணுவாங்க ஆட்டாம இருக்கிறதுக்கு. ஸோ லைக் செல்வி சிஸ்டர் said difficult IV access na முன்னாடியே even at this stage you can say seniority whatever, even then I'll tell there will be கொஞ்சம் உங்கள் வெயின் கொஞ்சம் கஷ்டமாக இருக்குது, சாரி மோர் தென் ஒன்ஸ் ப்ரிக் பண்ண அவசியம் வரலாம் அப்படின்னு சொல்லிட்டு முன்னாடியே சொல்லிடுறது. அட்வான்ஸில் அப்பாலஜைஸ் இன் அட்வான்ஸ். ஸோ சம் பேஷண்ட்ஸ் ஆர் வெரி ஸ்மார்ட். தேல் டெல் எனக்கு எப்போவுமே இந்த வெயின் ப்ராப்ளம் டாக்டர், எனக்கு சிசேரியன் பண்ணும்போது இப்படி தான் எல்லாத்துலேயும் குத்தினாங்க. அந்த மாதிரி கேஸ்க்கு டோன்ட் ஈவன் ட்ரை, கோ ஸ்ட்ரெயிட் ஃபார் த நெக்ஸ்ட். இஃப் யூ கேன் see a good vein, try. Otherwise straight away call somebody. So the question is, I think the system should be so good that I should not be getting a call for IV access. The training has to be better. You cannot expect a head of the anesthesia department to come at 10 o'clock in the night on a Sunday to put IV. That reflects badly on all of us. Okay? So all of us should have reasonable efficiency. Few of us, sister, you can train a few people for specialized thing. That is number, just like you are saying chemotherapy nurse or some other nurse, and the Mari tracheostomy care we have been talking for a long time. So just like we'll have a set of people who are properly trained to look after tracheostomy, like that we should have a team of people. A hospital, at least one person should be there in any given shift who has got advanced cannulation experience. Similarly, I am going to ask Dr. Kalpana to make sure all the DMOs know. And whether you are an orthopedic registrar or a gynae registrar, you should know how to put a line. That there is no excuse for that. We are all in the business of saving lives, and IV line is a very basic thing. So we'll do that. So don't hesitate. If it's difficult, don't hesitate to ask for help. And in the ward, patients can sometimes be rude. இல்லை ஒரு மாதிரி பேசுவாங்க, அதெல்லாம் மீறி நீங்கள் அதுவும் கேனலாவும் in OT I get the best type of cannula. Whereas you are forced to use whatever is available. So I really appreciate all of you, those who are putting IV lines for people day in and day out with bad lighting, bad height, no help, uncooperative patient with relatives watching. Big salute to you, but you need to get better at it.
I have one question to you, Vidya. The issue is, in one of the hospitals where I was working, the anesthetists say clearly, don't start lines in the ward before sending the patient. One. And second thing is, suppose if you have to spare one of the hands, which hand will you spare?
So normally for as a policy for all right-handed patients, we tend to take the IV line on the left hand, so that we leave the right hand to for dominant hand we leave free, but that also we can actually give patient a choice. That is one. So at least leave one hand free before you call for help, because if you have poked in both hands and then you call, the person who's coming to help also cannot help. Then we'll end up with jugular or central line or whatever. So 2-3 things. One is preparation. Sister again and again insisted. Many times I have come to the ward and then after that somebody will run for something. No, there should be a list of things that should be there in your IV tray. All of those you check before you go into patient's room, because patient will think badly of you if you run in between. Not only you are creating problem for yourself, it looks as if you are not prepared. So if you fail, they'll think as if it's your fault. But if you appear to be prepared, you are prepared and you appear to be prepared, and you talk to the patient before, during, and then when as soon as a problem happens, apologize first, which is true. No, you poked me, I had pain and it was unsuccessful. Apology is fully warranted, and that will diffuse the crisis. You won't believe when you talk properly. That day I felt so bad. One patient I tried, I think 3 or 4 times, and after all that was over, patient thanked me. Thank you, doctor. I felt so bad. But why? Because I had already, it was known it is difficult. I had explained to the patient beforehand, and then when I tried also I told and then apologized. So patient understood the difficulty I had, and instead of shouting at me, patient actually thanked me. So the talking that Selvi sister explained is very, very important for you to keep the patient's cooperation. And like she said, 2 times you try. If you cannot get help. Don't try to poke again.
Okay, thank you so much for your input, ma'am. Now we are going to demonstrate as a role play method teaching. Are you ready to see that role play? Consider as this is the patient arm. So can anyone come and touch this arm? It's a huge difference between human arm plus this mannequin, because it's too hot. So we have to do effective IV cannulation to get access. So I'm going to do role play. I am the nurse, and Deepan Vita, she is our new joinee from MDCCU staff. She is going to perform patient role. Just she will give that voice to understand this scenario. Good afternoon, ma'am.
Good afternoon, sister.
How are you, ma'am?
I am fine, sister. What about you?
How you are feeling? You're doing good.
I am feeling better now.
Okay, today Dr. Patasar came for rounds. Sir advised to give IV fluids because you are having that vomiting, no? So I am going to do IV cannulation. Is that okay for you?
No, ma'am. I have so much of fear about IV, ma'am. Needle also.
Don't worry. Just I am going to see your vein. Okay. Can I check your ID band?
Oh, sure, ma'am.
Your name is?
My name is Deepanita.
Yeah, it's good. Okay. I'm going to perform hand hygiene because infection control is prevention is very, very important for IV cannulation. Okay. Sometimes our infection control nurse, she will come for the rounds. So sometimes she will stand back of me and observe whether I am practicing infection control measures. Okay.
Okay, ma'am.
Okay. Okay. This portion is comfortable for you?
Yeah, ma'am. It will be
okay.
Okay, ma'am.
Okay. Then now I am going to see your vein. Do you have any pain?
No, ma'am. Now it's not pain.
No pain.
No, ma'am.
Okay. What is your hobbies?
My hobbies is dancing, ma'am.
Dancing?
Yes, ma'am.
Okay. You can do that dancing now?
How come I'll do now? I am now admitted now.
Once you get discharged, you have to do one dressing and send videos to me. Okay?
Sure, ma'am.
Okay, you have good vein. So this is simple procedure. Don't get worried. I can able to do that procedure. Okay.
Kindly try to one poke itself, ma'am.
Okay.
I have more fear.
Okay, take deep breath.
Sure, ma'am.
Relax.
Ma'am,
yeah.
before I should have one doubt and question I can ask you.
Oh, yeah, sure.
What purpose you should keep the IV cannulation? It will be necessary for me.
Yeah, it's very important because you are having that vomiting, you can't able to take orally, so we have to maintain your dehydration, and another part we have to reduce your vomiting. For that reason I am doing that IV cannulations.
Okay, ma'am. Okay,
So
ma'am.
now I am going to consider as I have wear the gloves. Then this is the alcohol swab. I am going to clean the IV site. So before about 2 fingers, tourniquet should be tied.
Sister, it's so much uptight for me.
Oh. So it's okay for you?
Yeah.
Yeah. Okay, good. Once again, I'm going to clean that site. Today, do you have?
Please, sister.
Yeah. It's very simple procedure. Take deep breath. Don't see that. Can you do that? You can able to do that. Your fingers close and relax, so I can able to see your vein.
Okay, sister.
Yeah. It's good vein. It's nice. Okay, small breath.
So just please slowly. Sister, pain is there, sister.
Yeah, it's finished. Okay, that blood is come. Okay, now I'm going to start IV fluids. Before that, I have to secure the line with this transparent dressing. Okay. So now I'm going
Sister,
to
can you remove the tighter? I feel pain now.
Okay. I can understand that. I can feel your.
No, sister, asking the tourniquet about the tighter.
Yeah. I'll remove that tourniquet. Now it's okay?
Now I feel relaxed.
Okay, now I am giving flushing to flush your line. Okay. Then after cannulations, after flushing, you have to write an date of time of procedure.
Okay, sister.
Okay, IV fluid is started. Now you are feeling okay?
Now I'm feeling better.
Your fear is reduced?
Yeah, obviously,
Okay.
sister.
Don't fold this hand. Suppose you want to get up from bed, you can use that elbow. Don't wet this hand. Okay?
Okay, sister.
Thank you for your cooperation.
Thank you, sister.
Any point you want to add this demonstration sessions? Because I think... Sure. So... Then after that, perform hand hygiene. Then replace the equipment is very important.
Hello friends. So many times you have called me for IV line, and you all will be very busy in the ward, and so many cases will be troubling you, and this IV line will be your torture because you have to get the antibiotics in, fluids in, dehydrated patients. You all will be so tense. We will also be in OT in between. Whenever we get time only we'll be able to come, but you will help us. The only thing I wanted is that tray. The tray which you prepare, everything should be there, as sister said. IV line, flush, fixing, that tegadam which you use, fixing, then the sharp which we did disperse, which we take out, right? We always keep it in that one tray itself. It'll get infectious there itself. Let's have a sharp discard box to be put inside so that there itself I can discard it. Whoever doctor or nurse, we can discard directly. You all needn't touch it. It becomes really messy. It has a whole bunch of things, cotton, swab, everything. Everything gets messy and infectious. So we'll get a sharp tray there so that we can discard it directly. Otherwise, what ma'am said, tourniquet I apply. Beyond that, that finger, that hold which you give now with your hand, more pressure it gives, and we'll wait for some time before we secure the IV line. We'll see the the vein properly. We'll drain through gravity, then we'll put the tourniquet, then you will give the pressure. Sometimes we collect the IV samples also. The samples tube you have to keep ready. So that is also very important. We prepare everything and make sure we have gauzes available. Sometimes we cannot control the backflow. It will soil all the region around the bed sheets and all that. And here we have the liberty to send the patient attender out so that we can work freely, right? So it's more convenient, less strain on us, and we are less nervous, right? So these are the points I noted while cannulating. Thank you so much.
Thank you, ma'am.
Always put something like rubber. You don't get rubber sheet nowadays. One, the tina bed or something, because the bed gets spoiled when you put. Second thing is educate the patient. After the IV cannula, keep the hand neatly and don't dirty it. Like suppose you're putting in the metacarpal, they might eat the food. The food gets spilled. That also causes infection. So teach them that not to rub it. Well, put the blanket, they try to, very harsh. That also can cause, mechanical phlebitis. That also can cause problem. So you have to educate this patient after giving how he has to take care of this, not to wet it and not to use it roughly. Keep it neat and clean and don't rub it. This is most important. Otherwise, I think keeping a sheet underneath the hand. Common thing when you give IV, you can see the embroidery. The way blood spread over the sheet. Again, they will make a big complaint. Run for the sheet, the problem we face. So these are very small things, but help you a lot in IV cannulation.
Yeah, I have 2-3 questions. First of all, whenever, I don't know, who's the person who starts the IV line? Is the sister alerted to that room, or what is the protocol?
So ideally, the sister was alerted. But
if the sister is very new, who's not...
I'm coming to that. Practically speaking, she gets so restless. Moment IV started, she'll be going, Akka, Anna, whomever nearby, she'll try to catch her up.
When will she start then?
Then in charge will start, if in charge is there.
Okay, she has to start one day.
She has to start by what we do in I think. We give the class like this. Plus I send them to phlebotomy room. When nurses come to me, I tell them go to phlebotomy room at least for 1 or 2 hours. So everybody goes routinely. When they look at it, they become a little smart. And then under supervision of in charge. And when they're confident, then they start on the board.
Now question 2 is, whenever I go on ward round, I'll call the sister and I'll ask the patient, "Ingo per therima?" They don't know. Do the sisters introduce themselves? I am so and so, உங்களுக்கு ஒரு IV line start பண்ண போறேன், அது வலிக்கு போகுது, 2-3 வாட்டி பங்க்சர் பண்ணலாம். அதெல்லாம் பேசுவாங்களா இல்லையா? என்னால முடியல, நான் இன்னொரு சிஸ்டர் கூப்பிடுறேன் அப்படி சொல்லுவாங்களா?
அப்படி சொல்ல மாட்டாங்க. They will suppose they will take IDET class எடுக்கணும் எல்லாருக்கும் சொல்லுங்க. We take class na IDET, acknowledge, introduce, சொல்றேன்ல கத்துறோம்ல அதெல்லாம் சொல்றீங்க பண்றீங்களா? They say sometimes they don't say always.
Whenever I ask, the patient doesn't know the sister's name. I don't know why.
See, look, all of you see, it's a real failure on our part. We will be taking classes regularly of IDET, correct? What is the IDET? Get up. What is the IDET? சொல்லுங்க எழுந்துங்க. What is the IDET?
Duration and delay, explanation and thank you.
So tell me in this IV what you're supposed to IDET. What I will use IDET for this particular thing. Come, I want you to, at least I want you to know whether you know it or not. Come, please come. Don't worry, come. Nair Kavani, good, you still very nicely. Suppose you want IV cannulation, how will you apply the IDET in the IV cannulation?
First explain the procedure to the
So
patient.
you just see, she is I am the patient, tell me. I am the patient, you are going to start IV. Tell me how you will introduce.
My name is Priyadashni, assigned nurse. I put the IV line. This is a small procedure. கொஞ்சம் மைல்டா பெயின் இருக்கும். Patient. Good morning, நல்லா இருக்கீங்களா? Casual பேசணுமா?
ஆமாடா, I am a patient. I am not a CN. I am a patient. I like to be controlled, loved. சொல்லு.
Okay, ma'am. மேம் உங்களுக்கு ஒரு லைன் போட போறோம். blood sample இருக்கு. blood எடுத்துப்போம். மைல்டா பெயின் இருக்கும். கொஞ்சம் அட்ஜஸ்ட் பண்ணிக்கோங்க. சிங்கிள் பிரிக்ல போட ட்ரை பண்றேன். சரிங்களா?
எவ்வளவு நேரம் ஆகும் இது?
ஒரு 10 minutes ஆகும் மேம். 10 to 15 minutes ஆகும்.
ஓகே. நீங்க போட்டுட்டீங்க போடுங்க. ஓகே போடுங்க. Just do it. Thank you.
First hand rub பண்ணிக்கணும் மேம்.
Patient they are taught we keep teaching them also.
That communication is
Yeah, I know, we keep telling them we go and do audit also in the ward, but not 100%. We are trying level best, doesn't happen always. One is they are paid of stress, the non-nursing jobs are too many. Second thing is they are stressed, they are scared to give the name also. They don't tell. It is true, I guess. But something. I can't do that. No, you can't do that. You are different from others. No, they become smart after 1 or 2 years, but startingly they may be scared also. You see, in fact, I want to give a nameplate, but where you cannot go and take out the ID button and see. Even patient cannot touch and see. It's very difficult. So I'm trying for that. If you get a nameplate, nothing like it. But yes, when they become a little elder, they say. But when they come newly, they are scared. If something goes wrong, then name will be quoted. That also the fear is always there. We try to eliminate that, but it takes time. Thank you.
Thank you, ma'am. Sir, after IV cannulations, we can collect the sample using this device. It's called vacutaneous. After this new initiative is it's formed by our chief of nursing. So after cannulations, through this, and this is called Luer adapter. Using this, we can collect the blood sample after cannulations. Thank you.
Next we have Ms. Najiha for Magical Moments in Medicine.
Good afternoon, everyone. Today is something about one type of transplant. So I just want you to guess what transplant it can be. No, not something very common.
Face?
No. No, sir. Something related to gastro.
Gut bacteria.
Similar, sir. Fecal transplant.
Very, very good. It's trending.
This is the transfer of stools from a healthy donor to a deceased patient's gut. So the aim is to restore the normal microbes, bacteria balance in your gut. It's one of the most effective medicine in GI. Why the microbes matter? The human gut carries more than 100 trillion microbes. It regulates digestion, immunity, metabolism and all your mood functions. That is, if there is a dysbiosis, that is imbalance, that causes infection, inflammation or metabolic disorders of your gut. So when would you do the transplant? So if there is recurrent or refractory Clostridium difficile infection, that is one of the main indication of fecal transplant. It occurs after prolonged antibiotic uses. So there will be loss of all your beneficial flora leading to the growth of the Clostridium difficile in your guts. So there will be symptoms of severe diarrhea, colitis, everything will be there. And it cures 90 to 95% of your Clostridium difficile is majorly cured by 90 to 95%. When you take all medicines, they say it's only up to 50%. So how you select the donor for giving a fecal? That is your healthy adult. It should be age of 18 to 50. Ideal BMI should be there, and the donor should have not taken antibiotic for the past 3 months. And the donor should not have any GI disorder, autoimmune disease or metabolic disorders. And then the screening test regular, like stool test is done to check if there is any bacteria or parasite in their stool. If they are infected, and regular serology is done. Preparation is the fresh or stool is collected and it's mixed with sterile saline or glycerol, filtered and the solid particles are removed and it's stored in negative 80 degrees Celsius. So how you administer it to someone? So the invention of the fecal transplant was like in Japan they were giving something called yellow soup that mixed the healthy fecum and they was giving for diarrhea. That's how it started. So how we give us is like we give it as enema, capsules or nasojejunal tube, but the most common is capsule type which is well tolerated. Enema is also used in mild cases. So what will be the complication of the fecal transplant will be cramping, bloating and temporary diarrhea, and the very careful thing is you should not transmit any multi-drug resistant organism to the patient, and bacteremia infections will be there. So the future of medicine may not always be in killing pathogens, but in rebuilding the life that keeps us healthy. So keep your gut healthy. Thank you.
Selvi sister, they have the Einstein Award attempt certificate distribution. So the nursing team will take over that.
See, we have done the IV cannulation. What do you give through IV? Medicine, correct? The most important procedure of any patient's life is medication administration. He comes for treatment. The most important is medication administration. So a lot of mistakes take place worldwide. A lot of errors reported because of not administering properly. So we had one program called Einstein World Record of Medication Administration Preventing Errors. It was organized by Annie. Annie, you know what is Annie? Assistant Executive Nurse, India. They are one of a professional body of nursing who talks for nurses, who work for nurses, and is a professional body. All of you should become members. I told you before as well. They conducted a class all over the world. Same time, same topic, same group. No, there was taught table, synchronized learning. So it was done by our 50 nurses also. We paid money for that. Then we got the world record certificates and a medal. So we are very happy to present, who was present here, those medals of the world attempt of medication administration and prevention of errors. I call upon, yes sir. So Einstein is one of the genius, no sir? Yeah, that's I just took him because of his genius. So he is the theory of relativity and all. No, he was the one who explained about the universe, how it functions. He is supposed to be one of a genius. So based on that, genius action. So it's called genius attempt of world record of medication administration prevention of errors. Educator Sebli was the trainer for our nurses. So she's one of the world attempt record trainer. So we must congratulate her. Sir, please come. I call Dr. Radhakrishnan to give this medal and certificate too. Give a big hand here.
Saumya, Vijay Kumari, Miss Anicha, Miss Meghala, Miss Muttamil, Ebenezer, Reena, Miss Reena,
Our Deputy Chief of Nursing, Ebenezer Fragrant, ma'am. And Reena's sister, quality nurse. Sandhya from labor ward. Srivani from 4B. Our beloved Lieutenant Colonel Nirmala Iyer, ma'am, Chief of Nursing. Thank you so much, Dr. Suman sir, for your certificate distribution.
Thank you, sir.
Please open your phones. 74765248 or this QR code. We'll finish the quiz as soon as possible today. Yeah, we are not going to wait for 20 participants. We'll take it as it comes. Good that we have 18, okay, 20 players. Here we go. You can still use the code on the top. What gives urine its yellow color? Option A, bilirubin, B, urea, C, urochrome, 3, creatinine. No, it's urochrome. You can still use the code on the top of the screen. It's 74765248. We'll find out what are those names at the end. We have 25, 26 players today. Highest that we have started, Menti. The longest nerve in the body is option A, vagus, option B, femoral, C, sciatic nerve, and D, median nerve. Kind of a trick question. Put your heads to it so that you can know the answer. Good, sciatic nerve is the right answer. It divides into 2 branches and runs into both legs, so it's the longest nerve. This is an easy question, but kind of tricky. What is the normal pH of blood? Answer should be input in your phone as soon as possible. Letting it out loud is not going to be any use. Good. 20 of the 26 people who participated got it right. Okay, everybody is in a steady run. 4th question. Which part of the ear helps maintain balance? Which part helps maintain balance? Is this the cochlea, eardrum, semicircular canals, or the vestibule? Which part of the ear maintains balance? And the answer is semicircular canals, not the cochlea. Cochlea helps with hearing. So many people lost this question. Lola has climbed up. Which ion is essential for muscle contraction? Sodium, potassium, calcium, or chloride? If you give out the answer loud, then the other person will also answer the correct one. Good. Calcium is the right answer for muscles. Nemo is on the run. You have 5 more questions. What pigment in skin determines the color? Look at the answers. It can be quite confusing. Is it melatonin, melanin, keratin, or hemoglobin? Right. Melanin is the right answer. Melatonin is a hormone. Okay, everybody is running steady. Nemo is still on the first. The pictures are clues. I'm just repeating. Which nerve is affected in Bell's palsy? Very easy. Trigeminal, facial, glossopharyngeal, or the vagus nerve? Which nerve is it? Okay. Yes, facial nerve is the right answer. That's the clue. Lola has gone down. 3 more questions. Question number 8. And here we go. The primary sensory cortex is located in which lobe of the brain? Which lobe of the brain is the primary sensory cortex located in? Is it the frontal, temporal, parietal, or the occipital? We'll find out. Okay. Most number of answers is given in parietal. Parietal is the right answer. Both. Two more questions. This one is quite easy. Which vitamin deficiency causes peripheral neuropathy? A, B12, D or K? Very easy, you can try. Good, most answers given in B12. B12 is the right answer. This deficiency is seen in vegetarians. Last question. Which infection shows a strawberry tongue? Mumps, measles, scarlet fever, diphtheria. Be careful with your options. The answer that's blurted out loud. Scarlet fever it is. Okay, now for the interesting part, we get to find out who won and who are those names. Nemo? Who's Nemo? See, you can do the honors, sir, today. Please give away the prizes, sir. Who's Vroom? Vroom, yes, on the stage, please. Mustaq brother from the OT. I request Dr. Patta, sir, to give the prize for him. Next, it's Agent X9. X9. Oh. Barefoot Contessa. Who's that? Barefoot. Okay. Thank you so much, sir. Please give the prize for him. There's someone, Casper. Casper. Please, sister, on stage, please. Thank you so much, sir.